Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 123,490 confirmed cases of COVID-19 in Canada and 40,870 cases in Ontario. Chatham-Kent has 356 cases and Sarnia-Lambton has reported 336 cases. Michigan now has 94,278 cases, with 13,279 cases being in Detroit. Today, we are reporting 2,452 cases of COVID-19 in our community, an increase of 2 cases from yesterday. 1 is a close contact of a confirmed case, and 1 is a local healthcare provider. 89 of our cases are currently active and are being followed by our health unit. 2,292 people have now resolved, 81 people are self-isolating, and 7 people are in the hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male and 35% are female. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. 2 retirement homes are currently experiencing a COVID outbreak, and 2 workplaces in the agri-farm sector are experiencing an outbreak at this time as well. Symptoms of COVID-19 can be mild or severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you're feeling confused or losing consciousness. Windsor-Essex will soon have 3 COVID-19 assessment and testing centres: Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Pending a 3rd site at Met Campus, a drive-through testing option will be available August 24th and 25th from 9 to 4, adjacent to the St. Clair College Sportsplex. SOHAC in Windsor also offers testing for First Nations, Métis, Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test results. To check your results, please go to wechu.org and click View Your Test Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or the healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you again for joining us today. Over the past few months, the health unit, different levels of government, mainstream and social media have repeatedly reminded residents of the importance of self-monitoring for signs and symptoms of COVID-19. The list of symptoms has continued to grow over time, and a comprehensive list can be found on our website. For those experiencing symptoms, we continue to recommend contacting your healthcare provider for guidance on next steps. We have also described the critical importance of contact tracing as a key intervention which limits the spread of the virus. Earlier this month, the Government of Canada released the COVID-19 Alert app, a mobile phone application that alerts users if they have been in contact with a confirmed case of COVID-19. The app runs in the background of your phone and uses Bluetooth technology to communicate with other nearby phones. When you have been in contact within 2 meters for over 15 minutes of another user who have been diagnosed with COVID-19, you will receive an alert through your phone, which will advise you on next steps. The app is available on the iOS and Android platforms and can be downloaded from the App Store or Google Play free of charge for all users. The COVID Alert app is just one additional measure that we can add to our toolbox in protecting ourselves and others from this virus. This app does not replace manual contact tracing by public health professionals, nor should it encourage any of us to let our guards down. I continue to recommend that everyone follow public health measures and continue your local healthcare provider if you get sick. One of the other important update from public health side is the ongoing migration of data from the integrated public health information system to a new online system, which is the case and contact management system. The data migration and the health units are moving into using case and contact management software in the recent days. And as a result of that, please expect a number of key issues that I want to bring it to everyone's attention. Because of the migration, it's still happening as we continue to deal with all these case and contact management and doing the COVID-19 work. Some data will not be migrated in a timely manner, which may result in some reporting delay and some discrepancy in terms of number of cases that we are seeing across the province. It also adds another layer of when we are migrating all this data, there could be some data verification and data migration issues that needs to be worked out. We can expect to see some variation in the number of cases that we are reporting, not necessarily from our health unit, but maybe from other places, other jurisdiction, as they clean it up and make sure that all the appropriate cases are counted in the respective jurisdiction. And as a result of this migration, there is no further challenges to that. Please also expect that there may be some temporary delay in reporting some of those data elements. We will try to use our local data using our systems as best as possible to do a timely reporting of the information that is available to us. It may not be different in terms of the number of cases that we are reporting, but some of the other data elements, there may be some variation, but we'll try our best to stay on top of it and provide you an update in a timely manner. But please expect that there may be some data issues at least in the next week, if not longer. And we'll update you when the complete migration happens and when we start to feel more confident in the data that we are reporting. The number of cases and the key indicators, we will be doing a parallel process to make sure that that's continued to be reported accurately to the community. But some of the more broader indicators, we may have some challenges in verifying the accuracy of that data. Thank you.
The conference is now unmuted.
We will now take questions from the media. We'll start with CBC.
Nothing right now, thank you.
Okay. AM 800.
Dr. Ahmed, yesterday was the 1 week mark moving to stage 3 for the region. With the numbers, then I know you look at 14 days, but so far, except for that 1 day for the Agra Farm jump, are you pleased with the numbers that we're seeing since we moved to stage 3?
Yeah, I think that's definitely a good sign, and we are definitely happy to see that these numbers continue to be in the range where we can expect from a region of our size. We'd like to see people being still more vigilant, and as more and more people are interacting, and the review of symptoms, taking all these precautions, and getting tested is still the key. But overall, I think we're moving in the right direction.
I believe Teresa mentioned this on Monday, but still getting a number of calls, emails, concerns. And is it safe to say that masks are still number one, or what else have you been hearing since we've made it to stage 3?
So I have looked at the complaints and the compliance checks we've been doing as we moved into stage 3. And the majority of issues are regarding the compliance with wearing masks. And then the next highest complaint is about physically distancing on patios. But masks and non-compliance with wearing masks continues to be the number 1 complaint.
Okay, thank you.
Blackburn.
No questions right now, thank you.
Windsor Star.
Yes, good morning, Dr. Ahmed. Is this a province-wide data migration, system migration?
Yes, the entire province has moved. Our region was one of the last one to move, recognizing that there were a number of cases were in our region, and we were trying to delay it, recognizing that every time this type of data migration happens, there may be some potential issues. So we were among the last one to move to the system, and that migration is happening as we are speaking. So that's why in the next week, it would be challenging for us to provide that data accurately while the migration is still happening.
And you said there could be discrepancies in the numbers reported between different organizations, but not necessarily in We Choose numbers. So does that mean that we may see the province reporting different numbers for our region than you are reporting?
Well, yeah, a combination of that, or even just a combination of what we are reporting for, let's say, Chatham-Kent, or what we're reporting for the entire province of Ontario. Some of the issues with that, that's possible, and some of that is linked to the data cleaning process. So obviously, we are reporting what information we are getting locally, so it's easy to keep a track on what the actual case count it looks like. But when we are reporting data elements from other regions, and when we are trying to do any kind of comparison or trying to pull data with more details, such as the symptoms or some of the other risk factors that we typically report in our epi summary, some of those details may not necessarily be transferred or migrated in a timely manner. So that's where we will see some discrepancy. But the case counts that we report every day from Windsor-Essex County Health Unit will be the data that would be as accurate as it can be, because we get all the positive results. So we will be reporting all the positives, and that would be accurate. But when it comes to getting a more doing a more deeper dive into the data, that's where there may be some challenges.
And separately, just curious if you have any more information on that website you mentioned yesterday in terms of release date. For the school information, is that correct, Taylor? Yes, that's correct.
Yeah, so I think one of our director was on vacation, so she just came back, and I had a conversation, and hopefully we'll get it up and running as soon as possible. I had a brief conversation, but didn't really get a chance to talk about the specific details of when it will be uploaded.
Okay, thank you so much.
No problem.
CTV.
Yes, good morning, Doctor. Just to get a feel for the numbers here, maybe this is a Teresa question, but the number of complaints, are they high, low? Have they evened off from the last time you gave us numbers? I think a few weeks ago in the 200s or whatever it was.
So I was actually looking at the overall spreadsheet that we have, and it looks like our enforcement officers are following up with about 10 complaints every day regarding masking or patios. The other department, though, that deals with a lot of complaints and inspections is also our environmental health department. So I didn't look at their spreadsheet, but they continue to do a lot of the compliance inspections as well for many facilities. But regarding our tobacco and vaping enforcement officers, what they're seeing and dealing with, it looks like at least 10 a day. Over the last, I went maybe the last week, and it looked like at least 10 a day.
Okay, I know Rob has brought it up a few times, but we're still in educational mode, right?
Based on everything I'm reading through their reports, it looks like they continue to educate. Most of the complaints that I saw in the spreadsheet are not like repeat offenses. It's someone's complained or there's a compliance visit, and they're providing the education, and I can see that clearly in the notes that many people have good practices in place, but there is always a little bit of room for improvement, and it looks like it's all education.
Okay, that's good to know. Just want to move on to the pop-up testing center over at St. Clair College. Have you guys received a lot of calls asking for more testing opportunities? Is that why this center is popping up?
We are not receiving calls about not being able to access testing. That the assessment centers that are available have done a great job, and we are on calls with the lab, so we know that the turnaround times are very good as well. I believe that Windsor Regional Hospital has been looking at a third site, and the St. Clair College Sportsplex is in response to schools reopening and giving people another option, and anticipating there may be more of a interest at this time, and as we go into, further into stage 3, into reopening of the schools, there may be increased demand.
So does the health unit encourage residents, families, teachers to get tested before school starts, or should we just let this play out, see how it goes in the first, few weeks?
Our health unit has always said that if you have symptoms of COVID, you should get tested, and that remains the direction at this time.
Okay, thank you.
Windsor-ite?
Good morning. The health unit's website is still showing data from yesterday on the COVID-19 statistics page. Is that related to the data migration?
I think it may be just a little bit of delay, so hopefully you will see the update on our website. I think that shouldn't be linked with the data migration. I think it's just a function of maybe some delay. We'll look into it, and we'll make sure that by the end of it, it is posted.
Okay, sounds good. Thanks.
Any follow-up questions from CBC?
Not today, thank you.
AM 800?
I'm good, thank you.
Blackburn?
No, thanks.
Windsor Star?
No, thank you.
CTV?
Good for today.
And Windsor-ite?
No, thanks.
All right, thank you, everyone.
Thank you.